Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, the Health Department intensifies its efforts against measles.
Ito po ay napatunayan ng dekalidad, ligtas at epektibo, at ito po ay walang bayad.
Declaring outbreaks in some parts of the country.
Nakita naman po natin na napakadaling ma-spread within the isang household.
The President vows to help in boosting the immunization programs.
It is good and it is for the health of the person.
Following a decline in parents' distrust of government-distributed vaccines, Health Secretary Francisco Duque joins us live. And later, a machine that writes Filipino poems. Find out on today's In Focus. Thank you for joining us. I'm Pinky Webb. The campaign period for senatorial candidates and party list groups kicks off today. This means election officials will now keep tabs on everything candidates do as they try to gain support from voters. The COMELEC will even monitor social media posts made by or for the candidate. Senatorial bets running under a political party are allowed to spend a maximum of 183 million pesos, while independent candidates can spend up to 305 million pesos. The end of the campaign period will be on May 11, and the elections will take place on May 13. We head over to Pampanga, where the regional party Hugpong ng Pagbabago, or HNP, kicks off its campaign. The group is supporting 13 senatorial candidates for the upcoming elections. HNP will have 2 events in the province today. Our correspondent Joyce Ilas is in Pampanga. Joyce, what's the latest there?
Pinky, Hugpong ng Pagbabago's campaign caravan for its Senate bets has started here at the Capitol grounds of San Fernando, Pampanga. It's a very festive morning. Campaign jingles of HNP and Senate bets play on repeat. Their banners and posters scattered all over the Capitol grounds. Hundreds of supporters of the senatorial bets HNP is endorsing are here. Davao City Mayor Sara Duterte Carpio has also arrived here at the Capitol grounds a while ago. Also here are House Speaker Gloria Macapagal Arroyo and Pampanga Governor Lilia Pineda, who sponsored this kickoff. Although HNP is a regional party, they are here because they have an alliance with Pineda's party, Kambilan. In their speech, both Pineda and Arroyo asked Pampangans to vote all candidates of HNP or those endorsed by President Duterte and his daughter, Sara. Duterte Carpio's HNP is endorsing 30 senatorial candidates, but only 12 Senate seats are up for grabs. Now here on stage are PDP Laban Bets, the former Senate Special Assistant to the President Bongo, former National Police Chief Bato de la Rosa, and former Presidential Legal Advisor Francis Tolentino. Also here are re-electionist Senator Cynthia Villar and J.V. Ejercito, former Senator Jinggoy Estrada, Bong Revilla, and Pia Cayetano, former journalist Jiggy Manicad, and Ilocos Norte Governor Aini Marcos are also here. After the campaign here in San Fernando, Pampanga, HNP senatorial bets are expected to proceed to Angeles City this afternoon for its second round of campaign.
Joyce Ilas reporting from Pampanga. The opposition coalition will start its campaign in Caloocan City. They will kick things off with a press conference this afternoon. The so-called Ocho Diretso will then go around areas near San Roque Cathedral and will end with a mass. The coalition is composed of former Senator Ma Rojas, former Bangsamoro Transition Commission member Samira Gutok, former Solicitor General Florin Hilbay, former Congressman Erin Tañada, Congressman Gary Alejano, election lawyer Romulo Macalintal, lawyer Chel Diokno, and Senator Bam Aquino. All hands on deck in boosting the government's immunization program. This after the Health Department declared a measles outbreak in some parts of the country. The DOH admits that convincing parents to vaccinate their kids remain a challenge. Let's go straight to the source of the story. Health Secretary Francisco Duque III. Secretary, welcome back to the show.
Well, thank you very much, Pinky. And in behalf of the DOH, I'd like to thank you for the opportunity.
Absolutely, sir. We've been wanting to talk to you about this. In fact, I'll be the one to say it that way back when we spoke over the phone in an interview, you were already calling out for help for the vaccination program of the government. Kasi sinasabi niyo po, nun pa lang, mababa na yung rate. So let's look at this, sir. So far, the DOH says 4,032 measles cases and
4,302 with 70 deaths.
With 70 deaths, only from January 1
to February 9
of this year.
Yes.
So the DOH declared a measles outbreak in certain areas. How would you describe the current situation now?
The current situation, I would say, is number one, insofar as San Lazaro Hospital, which is the end referral hospital for infectious diseases, continues to have admissions of measles, and more often than not, this also includes complicated measles. That's the problem. Pneumonia is one of the, if not the deadliest complication of measles, complicated case of measles. But when I did my rounds, Baseco, for example, and then Payatas and Pansol and among others, I really saw for myself really a marked difference. Ang daming tao parang palengke sa Baseco. So, ako naman tuwa na sabi ko, sana tuloy-tuloy na ito, na ramdam mo na yung pananaw ng mga tao, nagbago na. Mukhang bumabalik na unti-unti ang kanilang tiwala sa bakuna at hindi na dapat sila nalilito doon sa mga issue bunsod nung
let's say dengue. Let's call it as it is, sir. Yeah.
So, so maganda naman yung nakikita ko kasi parang may pagbabago finally after incessant calls, last year about, I've been sounding the alarm that, we are gonna get these outbreaks,
So, it's still a measles outbreak. We still call it that now, sir.
Yes.
Hanggang ngayon. Measles outbreak pa rin siya.
Not an epidemic, but just a measles outbreak, which means there's a massive increase in the numbers. What used to be 1, 2, naging 400, naging 300. And implementing the regions with the highest measles cases are regions 3, 4A, 4B, NCR, region 7. There's one common thing about the 4 with the highest registered measles cases. These are all, or these were dengue implementing regions.
Doon nag-umpisa doon yung injection ng dengue.
Yes.
But what we have, sir, is NCR with, these are the regions with the high reported measles cases. Right. Is this still correct, NCR, at 1,296 cases and 18
deaths? Yes, I think that still is the case.
So we still have NCR, Calabarzon, Central Luzon, and what you were saying is that there is, as concluded, sir, dyan din po yung mga areas kung saan nagkaroon ng injection of dengue vaccine.
Right, exactly.
So, do you at least are saying that there's this good news because people are now, because of the measles outbreak, pumupunta na ngayon sila sa mga health centers?
Yes, and I interviewed them. And then sabi ko, mabuti naman at nabalik na kayo dito sa health center para pabakunahan ng mga anak ninyo. Kasi natakot kami dun sa pagdeklara nyo ng outbreak. Sabi ko, at saka may mga namamatay talaga. Sabi ko sa kanilang gano'n. Yung isa nga umiiyak pa sa akin. Sabi niya, yung anak ko kasi namatay yan, sabi niya, naluluha siya. Kaya dinala niya na yung mga sunod-sunod na mga anak niya. Kaya sabi ko, kailangan ba may pumanaw pa, Mrs., bago nyo malaman ang kahalagahan ng bakuna?
Sec, what are the main reasons?
Main reasons based on independent studies. The London School of, well, let's begin with the WHO. There's a myriad reasons. Number one, the dengue scare. Then number two is that the parents more often than not say, wala akong oras, wala akong panahon, busy ako. Third, some would say, wala ho akong pamasahe. Others would say, ayaw ng tatay. And more commonly also, next to wala ho akong oras o walang panahon is, ano nga ba, isa na yun? Sometimes I forget. Senior moment.
Yes.
May lagnat. May sakit.
May lagnat yung bata.
Kasi bawal mong
kailangan
turukan.
kailangan healthy yung child
Yes,
bago ano.
exactly.
Okay, but the main reason would be, it's a myriad of reasons you're saying, but the number one was it the dengue scare?
Well, it actually occupies a tie with wala
Busy sila.
oras o busy.
Silang dalawa.
Yes, silang dalawa.
Because you can tie that up with obviously the loss in confidence in government's immunization program because of the dengue scare. So if you were, I know, sir, you want to move forward with this together with other senators as well, no? What can be done? The president is saying that he even wants to spearhead a campaign on the immunization program. Exactly what can the president do? Is there a program in place, sir?
Well, he already did, because 2 weeks ago we were in Malabon when we broke ground the San Lorenzo Ruiz General Hospital in Malabon. And then the president extemporaneously said, you know, he appealed to the parents. Kailangan magpabakuna kayo. Yan ho'y mahalaga sa inyong kalusugan ng mga anak. At wag nyo nang isipin kung ano yung mga konting mga side effect lang. Wala yan. Ang importante is mas malaki yung benepisyo makukuha ng inyong mga anak. So he already started it, no? 2 months ago and 2 weeks ago. And then, of course, now, moving forward, that is what, to me, is most important.
How do you move forward?
Yes,
What
yes.
are the plans in place?
Well, yesterday, number one, we had a National Disaster Risk Reduction Management Council meeting and the RRMC Council meeting. So we had DepEd, the ILG, the SWD, PNP, AFP, Bureau of Fire Protection. Then we have DepEd, of course, will have a central role in our response to the measles outbreak. And then we have PhilHealth as a funder of, you know, the measles cases that are admitted in the hospital. But hopefully, wala na. Kasi mas malaking magagastos natin eh. Pagka pupondohan natin, antayin natin magkasakit. Whereas ang bakuna, it's really far more cost-effective. So what we're going to do is a mix strategy. No? Number one is we're going to do a non-selective as well as a selective mass measles and polio. We will take advantage na
Isasama
pati
nyo na.
polio, isasama na namin because there is a resurgence of polio, by the way, in some Pacific Island countries, Madagascar as well, and in some, I'm not sure if some African countries, no, but that's subject to validation. So, number one, we're going to do a non-selective target community-based and house-to-house, okay, vaccination. And this will include now children 6 to 59 months of age. We will give them one dose of measles-containing virus with vitamin A supplement. And then the number two part of our strategy is a selective target-based, target school-based in collaboration with the DepEd. So ito yung from kinder to grade 6. So yan ang gagawin natin, and all unvaccinated, incomplete grades 1 to 6 pupils in preschool. The preschool kasama dito ang DSWD. Okay, yung mga daycare centers. So massive ito, massive.
Sabay, are you going to do this?
Yes. We will have to do this all at the same
simultaneously.
time. Yes.
So simultaneously, yung you will predetermine the houses that you will go to.
Exactly.
And then also predetermine the schools that you will go to in collaboration, of course, with the other agencies.
DepEd in particular and DSWD.
When will this start, or has it started?
What we have started, actually yung supplemental immunization activities natin tuloy-tuloy yon. And then, in fact, last year, I had to start it last April 2018 because I already knew for the past 3 years, mababa na yung vaccination coverage ng Pilipinas. It was only, during my time as first-time Secretary of Health, my measles coverage was 90 to 95%.
What year was this, sir?
2009, my last year in office as Secretary of Health. And I don't know what happened from there. So I saw the records in 2015, 16, 17, as a 70, 68, 67. So, ganun na lang. 65 to 70. Pababa. And then, in 2018, during my time when I came in although, of course, I came in much later, 2017, 2018, sumadsad ng 40%.
We're talking about unvaccinated children. I'd like to separate that, Secretary, so that they understand this. We understand it better. So, you're looking at an approach on measles for now, pero isasama nyo na yung polio doon po sa households tsaka sa schools, tama ho ba?
Well, isasama muna namin ito doon lang sa children 6 to 59 months of age.
Right.
Okay, but doon naman sa school-based, we will be giving them depends on their history of immunization. No? Kasi kung meron silang proof na nabakunahan na kumpleto na, no need.
Nabakunahan na ng kumpleto ng ano, Sec?
Well, measles, and then FIC, fully immunized child, polio, DTP, diphtheria, pertussis, tetanus,
Lahat na yan.
BCG, polio, and then hepatitis B.
And if not, gagawin nyo na rin?
Oh, yes.
Forgive the question, Sec, before we go on a break. Pwede ho ba yung vaccine, pwede ho ba yun sabay-sabay, one after the other? Ganun ho ba yan?
Hindi, meron naman scheduling. Meron naman scheduling.
Pero hindi pwede, kailangan...
Normally kasi within 1 year, dapat makumpleto mo.
I see.
Yes.
Yung lahat ng vaccination.
Yes.
So, program ng gobyerno. So, what you're trying to do is, it's not just measles anymore, it's going to be all the other vaccines also.
Well, we will do that, but the more profound campaign will be for measles.
We'll be taking a short break. This is The Source on CNN Philippines. Still to come, what other diseases or illnesses could spread if distrust and vaccines continue? Health Secretary Francisco Duque will still be with us after the break. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. So just to clarify that, sir, yung 6 months to 59 months dun sa households that are targeted, you're looking at giving them a vaccination for measles and polio. Pero dun po sa kinder to grade 6, ang thrust or focus talaga is measles.
Measles lang.
Got it.
1 dose of measles-containing vaccine, and then all pupils must present their proof of vaccination status to prove that the child has completed at least 2 doses of MCV.
Is that
measles.
all they need, sir,
Yes, for now.
Secretary? Dalawang injection ang kailangan po para sa measles?
Yes, because one will only give you 85% protection. The second one will give you 95% protection.
Why is that?
But why is
Ganun
that?
ho
Ganun
talaga.
talaga yun. You know, you get injected with the measles vaccine. Your body responds immunologically, producing antibodies. The antibodies are the soldiers of the body. They're primed so that once the real virus invades the body, the soldiers are awakened, and then they all now, you know, but you're only 85% protected, so may 15% ka pa.
So, ibig sabihin, Secretary, pwede pang magka-measles kahit sa unang round ng immunization.
Of course.
And then when do you give? When are they supposed to take the second round?
Well,
after how long?
12 months. 12 months, 9 months, first time you're given. This is under normal circumstances. And then the next is 12 months, booster at 12 months.
You mean 12-month-old or after 12 months,
12-month-old.
Okay, so dapat...
That's the last in the fully immunized vaccination program.
So that means they have to be vaccinated at 9 months.
And 12.
And then again at 12 months.
Yes.
Sek, paano pag i-vaccinate sila ng later on? Ganun din, 3 months then after yung second, yung supplemental?
Pagka natapos na, there's no need. Ngayon,
Yes.
kung walang history, kailangan talaga ulitin mo.
No, I'm saying, sir, dun sa hindi nagpa-vaccinate,
zero.
1 taon na sila, 1-year-old na sila. So ngayon, magpapa-bakuna sila. Kailan yung second round nila?
Well, it could be 3 months after.
Yeah?
Yeah?
Ganun din.
Ganun din.
Okay, you talked about the unvaccinated children. You know, sir, it did say that in 2015 there were about 500,000 children unvaccinated, and then
that increased in 2017 to about almost
855,000, sir.
That's right.
And then in 2018,
960,000.
almost 1 million.
Yes.
What does an unvaccinated child mean? Ibig sabihin ho, lahat ng ino-offer ng gobyerno, hindi po sila kumpleto?
Either hindi na bakunahan,
At all.
defaulters, ibig sabihin niyan, there was, they signed up for a scheduled immunization pero hindi sumipot. For myriad, you know, of reasons, no? Yung iba naman, they just had a first-time vaccination and then they never came back for the subsequent vaccinations. Okay? O walang booster dose, for example. Or completely just lost to follow up. So, yun ang mga defaulters.
They form part of the unvaccinated children.
And let me just also stress the fact that since this is one of the weaknesses of having devolved health to the local government units, hindi namin makontrol yung sense of priority that local chief executives ought to have over their health systems. So that if it's not their priority, that is also explaining why. No? Kasi yung mga ibang local government units, they have other priorities, infra, basketball court,
waiting shed,
and really help sa kanila dahil intangibles to, no? So, parang nakakainis din. That's why I was talking to Senator Gordon. Sabi ko, I think we should revisit the local government code and look at whether, after 2 decades, what are the gains of having devolved health to the LGUs?
Do you think are you saying it's not working?
Well, in some LGUs, the richer ones, they're successful. Makati, QC, etc. But for the poorer ones, wow, do you see decrepit, dilapidated, health stations, health units, health centers. So I think time has come for us to revisit the wisdom of having devolved the health systems to the LGUs. Because unlike DepEd hindi yan dinevolve. And lalo na hindi dapat dinevolve ang
But that's
DOH.
going to make your job harder. Kasi if you don't devolve that, babalik. Kanino babalik? Babalik sa health department.
Yeah. But it's not because the job is going to be easier. It's because the job is going to be more effective rather than more difficult. What is important, nothing is easy, okay? Everything is difficult. But it's the health outcomes that are our priority.
You're willing to take on that challenge,
Of
Secretary,
course.
you're saying, that ibalik na lang sa health
because
department.
I can control down to the basic delivery unit.
Top to bottom.
From top to bottom. Meron akong sasabihin, didiretso na yan, hanggang sa baba. To the basic delivery unit of primary care. Primary care embraces immunization. It's one of the major programs of primary care, immunization. Pagpunta mo dito, Andiyan ang LGU. Sabi niya, hindi, kunyan, maraming rason, maraming dahilan. So, kumakain ng oras, in the meantime, nagkakaroon ka na ng spread, in the meantime, nagkakaroon ka na ng outbreaks. Bumabagal. Sobrang inefficiency. Sobra. But hindi ko nilalahat, don't get me wrong.
Yeah.
And, with all due respect, there are several LGUs that really need to be where their health systems ought to be renationalized.
But also, I guess, it's time to put this in the consciousness as a top priority for the local government officials, Secretary, now that it's with them.
Yes. We've been telling them that, PhilHealth, your dad was an author of that. And really, that is the saving grace because somehow it resutured, it put back the mangled parts of the health system via a common financing system, which is PhilHealth. Yun nga ng saving grace eh. Yeah. Pero dito makikita mo na sa immunization, no? Mga local government units, titingnan mo, ang daming variations pagdating sa priorities. Some people, okay sa kanila, health talagang, they're convinced, good health is good politics. Really, so, ganon ang nangyayari ngayon. So, kailangan i-revisit talaga yung devolution ng
And what did Senator Gordon say about that?
Niya, well, he seemed to be initially receptive about it. Yeah.
Because he's also helping with this measles outbreak. Because sa San Lazaro, they put
he's
up a
setting
tent.
up tents in San Lazaro together with Dr. Susie Mercado.
That's right.
Susie Pineda Mercado. So, they're doing that. They're coming in really quite substantively in terms of complementing our efforts.
So, it's a measles outbreak. I wonder if there's still another outbreak in the offing. We'll find out after this short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Is there an outbreak in the offings?
Well, we're watching regions 9, 11, and ARM, but so far they've not registered any outbreaks, no?
On what?
Measles.
Measles also.
So those are about the only 3 or 4 remaining regions without outbreaks. But for dengue, I know there are outbreaks, some in, but I'll give you the data later. I just haven't really opened my iPad.
Is it a cause for concern now, dengue?
It always is a cause for concern because dengue, if it is not managed early enough, can very quickly turn into dengue shock syndrome, and that's also fatal.
But has there been an increase, a spike?
Yes, I know, but I just can't recall which regions, kung Central Visayas or Western, Eastern Visayas.
Okay.
So, but anyway, I can give you that later.
We'll get that information so it's more accurate little later, Secretary. Maybe just as a last question, because we're talking about dengue, what can we do to prevent this? Maybe just as public service, Secretary.
Yeah, dengue, wala pong gamot ito, unang-una. At ang pamamaraan lang po upang maiwasan ito ay sundin po natin yung tinatawag natin 4S. Ito po yung search and destroy, seek early consultation, self-protective measures. Ang panghuli po ay selective fogging in areas na meron na pong patunay na nagkakaroon na po ng outbreaks. So yung pong search and destroy, simple lang pong mga gawain ito ay itaob ang lahat ng pwedeng mapunuan ng tubig dahil doon po ang magiging breeding ground
yung
ng
stagnant water.
Stagnant water and breeding ground ng mosquitoes, yung kitikite. So, yan po yung mga lugar
Dapat walang ganon, tanggalin nila yon.
Itaob lang, itaob lang.
Baliktarin ninyo.
O kaya kung talaga hindi mo maiwasan, pakpan ninyo yung mga balde ninyo.
And the second, Sec?
The second is, of course, seek early consultation. Ito po ang pinakamahalaga sa lahat. 38 degrees centigrade, more than 2 days. Daligyan na sa ospital, para yan, meron na po tayong mga pagsusuri ng dugo para malaman kung meron po kayong dengue.
2 araw lang po, dalhin nyo na daw kayo or ang inyong anak sa ospital kapag may 38 na
degrees
fever.
centigrade.
Okay.
Opo. At yung pangatlo po ay ang self-protective measures, yung mag-long sleeves hanggang sa maaari. Iwasan po yung mga itim na mga suot kagaya ng kay Pinky kasi dyan po ang gustong-gusto ng mga lamok. They're very attracted to the black. Because if you look at the mosquitoes, they're black with white bands, right? Now, if you see them, and by the way, ang mga lamok na yan, napupunta po yan sa blind spots ng mga tao dito sa mga lugar. Kaya kailangan titignan
Hindi mo
ninyo.
nakikita?
Hindi mo nakikita sa blind spots. Hindi sa harap, hindi sa likod, pero sa mga gilid-gilid ng katawan.
Okay, and then number 4?
Number 4 is, okay, say yes to selective fogging.
Yes.
Makipag-ugnayan po sa inyong mga lokal na pamahalaan at sabihan sila na kinakailangan po magpausok na para nang sa ganon ay mabawasan o malaso ng mga lamok.
Sec, I hope that there will be a return in the confidence of the immunization program of the government.
And we work so hard. The very hardworking DOH health workers are, the employees, the officials, everybody is into this. So we'll come together. Yes, thank you very much.
And to the whole DOH, maraming salamat. Thank you, Health Secretary Francisco Duque, and thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.